And so I suspect others may have kind of talked about this, but as a little background, though, it used to be that ovarian cancer grade, meaning how aggressive or scary do those cells look under the microscope, was grade 1, 2, and 3. 1 being sort of the least scary looking, maybe growing the most slowly, to grade 3 being sort of the opposite of that, most aggressive behaving and scariest looking under the microscope. And over time, this has sort of changed to really more binary. Low grade, high grade, as opposed to sort of 1, 2, 3. And these are the definitions for how that was decided at the pathology level, but it has to do with how abnormal those nuclei look and how much it looks like they're dividing. And a lot of that work was done at MD Anderson many years ago. So again, just to kind of review initially, when you are getting diagnosed, you have baseline labs. Tumor markers are done. Often CA-125 is probably the most important, but there are others, and a CT scan. And it may say things like ascites, which is the fluid that can sometimes form in the abdomen when you have kind of cancer speckled through there. Omental caking, that means sort of a thickening of the omentum, the fat pad that hangs from your colon. Or carcinomatosis, so those little speckles of disease that can kind of land in various places. And so that's part of your initial workup. The stages that I know you guys are all familiar with, and this, I'll just kind of go through this quickly, but stage 1 is really confined to both ovary, or one or both ovaries. Stage 2 may have sort of spread a little bit into the pelvis, but not beyond that. Stage 3 is more kind of full abdomen, so maybe there's something outside of the pelvis in the omentum or elsewhere. And then stage 4 is really, is it inside the liver, in the lung, or sort of outside the abdominal cavity as well? And so, you know, most ovarian cancers at large, and including low grades, are diagnosed at this stage 3 and 4. It's typically staged surgically, meaning, and a combination of imaging as well if it's really clear. But often we determine what somebody's stage is as part of their sort of upfront surgery. And like I just said, about 70 to 80% of patients have stage 2 to 4 at the time of diagnosis.